Now, this is really an addendum to the neurological screening examination. These are other parts of the physical exam that we could embark upon if we pick up some abnormalities with what we've already done, or if the patient has specific complaints, like a big complaint of vision, for example, will lead to some other more refined testing. If the patient complains of trouble with their sense of smell or their sense of taste, both of which are interrelated, then we would want to more specifically test for that at the bedside. So to test for smell, for example, things that could be available in the office would be perhaps some coffee grounds or a bar of soap, and we could test one nostril at a time with their eyes closed to see if they can identify this common smell. So that's what we're going to do. I won't give you anything too noxious. And if you can close your eyes for me. Okay. And could you just put your finger here to cover that one nostril? Okay. And I'm going to just have you to take a whiff here without looking. Can you guess what that is that you're smelling?
Coffee.
Okay. So that's the right nostril. And keep your eyes closed and cover your right nostril. Now we're going to test your left. And could you take a whiff there? Tell me what that is.
Soap.
Okay. So olfaction tests out pretty well then. If we want to test taste, what I would do is make up a solution, perhaps with salt or sugar for a salty or sweet solution. And I'm going to put this solution on your tongue with this cotton tip, and I want you to tell me what it tastes like to you. You can close your eyes again. Stick your tongue out for me. Okay. And then we would drape it, coat it, paint it on the tongue, one side at a time, and have them identify whether it's salty or sweet. Okay, you can open your eyes. We talked about if there was an abnormality in the history about vision, or if we were picking up some abnormalities on the screening visual field. So it'd be there, at that point, a good idea to check for visual acuity. If you have a Snellen chart on the wall, or lacking that, if you have a pocket screener that has a mini Snellen chart, this is what we'll use right here. And they should be wearing their reading glasses, especially when we're checking a card this close. With older patients, they'd have trouble reading these numbers just because of the problem with presbyopia, which is the advantage of a wall chart. But in any way, they should be wearing their glasses or their contacts to accurately check vision at their best. I'm going to check your vision. This is just like the eye chart in the doctor's office, the eye doctor's office. And I'd like you to cover your right eye with your hand. So she's going to use her palm so she's not peeking through her fingers. We're going to look at your left eye. And how about if we turn a little this way, and I'm going to have you hold this card about 12, 14 inches away where you could comfortably read those numbers for me. And then I could have the patient read the lines. I could walk her through to get down to the smallest line of numbers that she can read out loud for me. Okay, could you read this line over here out loud?
937826.
Okay. So, for example, that would be the 20/25 line of vision. If that's the best she could do, that would be what I'd record for acuity. Could you put your hand down? Could you cover your left eye with your palm? And then again, hold this with your hand. And about 12, 14 inches away, comfortably. And she's going to read down to the smallest line of numbers, and I'm going to record that number.
428739.
Okay. Can you go any further than that? That's the bottommost one.
Line.
Okay. So that's a 20/20 line for that eye. So that'd be one way of checking visual acuity. Now, if there's a visual complaint or something we pick up with the screening exam, we want to more thoroughly, carefully check out visual fields one eye at a time. With both eyes open, we really don't adequately check the nasal fields. So we're going to really more accurately look at things if we do one eye at a time. So we're going to check your vision again out in the periphery, and one eye at a time. So if you put your palm over your right eye, I'm going to cover up my opposite eye, which is my left eye, with my palm, and you're going to stare at me right at my big ugly nose. I'm going to hold up my wiggling finger again, and you tell me when it wiggles.
No.
And I'm going to move really through her whole periphery.
No.
Even the nasal fields here.
No. 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 No.
And again, I'm comparing my answers to hers and trying to keep my finger about midway between us. Okay, put that hand out, cover your other eye, and I've switched, and you're staring at my nose, and I'm likewise staring at yours, and my hand's about midway. Tell me when the finger wiggles.
Now. 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 Now.
Okay, very good. The other thing, if there's a problem with vision or with eye movements, you can check for the near reflex or for accommodation. And what I'd like you to do is hold your finger out in front of you and just, actually I could do this myself or the patient can do it. I'm going to hold my finger here and I'm going to move it in towards your nose. Just keep following me all the way in, make you cross-eyed. Okay, so I will see her eyes 80 duct together and the pupils constrict. Or I could have you do it the same way. Hold your finger out and pull it in towards your nose and watch your finger. Okay. Okay. If there's a problem with facial sensation, the corneal reflex would probably be appropriate. It's a little bit of a noxious part of the exam. And what we would do would be to use the cotton swab again. Patients should have their contacts off, otherwise they won't have any corneal sensation to test. I've teased a little fiber here. Now what I want to do is gently touch this cotton on your eye. It's a little obnoxious. I want you to look to the left there. And, okay, as I touch it, she blinks bilaterally. That's normal. Now, could you look toward me? Keep your eyes open wide. And then she blinks bilaterally, consensually there. And you might need to hold the eyelids gently open if they have a lot of trouble keeping their eyes open there. The other part of the fifth cranial nerve is the trigeminal motor function, and those are really the muscles of mastication or the chewing muscles. And what we can have you do there, we would check into that if you're saying you're having difficulty with chewing or swallowing or weakness in the face. If you could just bite down for me. And if I palpate here, can you relax and bite down one more time? I could feel her masseter muscles contract. Up here I can feel the temporalis muscles contract as well. Okay.